if I were to pick a dental floss, any floss that the patient will use is a good dental floss. But if I had to show a preference, I would probably pick a woven floss, like a Johnson & Johnson. They have a woven floss. In the office, we use regular floss. We use like a dental tape. We use Glide, which is like Teflon, and a woven floss. Probably I think the woven floss is best. Most often in the office we're using just a regular dental floss. We got to have all of them because we're using them for different purposes. So like when your hygienist cleans your teeth, at the end of the cleaning, a lot of times she'll run the floss through between your teeth. She's not trying to teach you how to floss. Don't use that as an example as how to floss your teeth when she cleans at the end or when she flosses you at the end. She's just trying to get the pumice out from between the teeth before she lets you go. That's not a flossing lesson. If you want to learn to floss, you need to do it differently than that. When it comes to the wax floss, I'd like to stay away from the wax floss because it just leaves a wax residue on the teeth, which lets the plaque grow back faster. Glide, a lot of people they either use waxed or Glide because it goes in and out, and it does, but it just doesn't clean nearly as well. Glide is kind of like using a plastic bag to clean your teeth. It goes over real quick, but it doesn't take much off. So they're there for a purpose, but they're not necessarily the best cleaners. That's why I would tend to go to a woven floss. If you were to ask me what do I think probably gives a patient the best value of things that they can do to take care of their dental health, probably the best thing that they can do is get their teeth cleaned. And not everybody needs to clean them every 6 months. Some people need to clean them every 4 months. Some people need to clean them every 3 months, some more often than that. It's different for every person. But if I were going to have people try and get the most for their money, I'd tell them, figure out what you need. And it's better to spend a little bit more on getting cleanings a little bit more frequently. You'll end up with a lot less problems. Probably one of the other things I would do is get a Braun electric toothbrush. I think they're fabulous. I would probably pick up some Act fluoride from the grocery store. That does a lot of good. You want to almost treat it like toothpaste and brush it into the teeth rather than just rinse it on. Fluoride doesn't go through the little coating on your teeth very well. Your teeth feel really clean after you get your teeth cleaned by the hygienist. They stay that way about 10 minutes. And then you get this coating back on the teeth, which is from the saliva in the mouth. That coating protects your teeth from things that hit it, like a Coca-Cola hitting it and doing damage instantly. It has to go through that coating, which helps protect it, but that same coating is what stops the fluoride from absorbing into your teeth as well. So if you're going to do the fluoride, it's probably a good idea to almost treat it like a toothpaste, put it in your mouth and brush it on in.